Access to healthcare can be complicated. Many people experience system barriers, leading to a sense of powerlessness and lack of control. While Canada's healthcare system is one of the best in the world, people still find that they often have to go to great lengths to access the care they need.
There may be a lot of embarrassment, there might be a lot of shame, there might be a lot of fear, and yet the system is very rushed, and people aren't always well supported in those meetings.
When I first got here, there was no doctors. They wouldn't accept anybody, especially if you're on narcotics or certain medications and that. I had to go through Canadian Mental Health to access a doctor.
The barriers that we faced is primarily transportation, because sometimes we have to access services further away from home. As a single parent, I do have limited access to transportation.
Illness does not just impact the person who is sick, it touches every corner of life. For many people, days off work can lead to a limited income, which means it can be difficult to get to appointments and pay for transportation. Even in hospital, many people find accessing employment insurance, disability benefits, or workers' compensation challenging.
Into employment insurance? Well, I got down there and I had to get someone to open the door. There's no wheelchair access into there. She just said, well, I was on the committee. She says, I never thought about it because you see, it's a staff facility. I said, well, you don't have any staff that aren't handicapped anywhere?
Our healthcare system is a wonderful system, but a lot of it is dependent on conforming to a very structured schedule for patients to be able to access that system. We certainly know the whole fact that they have to change their whole day to actually access care is a deterrent for a lot of patients and their families.
The healthcare system is built by and for people. While barriers may seem insurmountable at times, those working in healthcare can contribute to people's overall well-being by meeting them where they are and responding to their individual needs.
Just being non-judgmental, because some of the clients don't really share some of the issues they have, whether it's injection drug use, whether they're sharing that they're gay or bisexual or transgender, like they don't even want to share that information with their family doctors. I think sometimes people have to work it through themselves before they feel comfortable asking those questions with the clients that come and see them. Having even midwives that will come here to see one of our clients, which would probably normally not go to a maternity center or a midwife or looking at having good prenatal care or the best prenatal care we can provide for them. Now we have a midwife that will come on site in a call and will be here probably within an hour.
Community collaboration is central to a responsive, person-driven approach to healthcare in the 21st century.
We do need to change the minds of patients in our community as what they think is healthcare. It's all the preventative care that we can provide to our community. That's really where in the future healthcare is going to lie. And the hospitals will only be reserved for those who truly require a hospital high-level type care.
What matters to me is accessibility. I like to be able to go places when I want to go places. That's what I want more than anything.
What matters to me is a matter of equality. The government, everybody needs to treat human beings as equals. A user, a non-user, old, young, crippled, crazy, it doesn't matter. We're all the same people. We deserve the same kind of health care.
What matters to me in healthcare is to have a healthy me so that I can have a healthier family and a healthier community.